morning, Dr. Moses. Thank you so much for joining us today for this interview. I really appreciate you giving us your time out of your busy schedule. My name is Kayla Fraser. My colleague here, Chancia LaRose, she will be the one interviewing you today. Thank you so much for giving your time, and we're going to begin now.
Good morning, my name is Shanae Rose. I'll be asking you a few questions. The first question I'd like to ask you is, what are some practical strategies for managing and reducing suicidal thoughts?
Good morning. Thank you so very much for the opportunity and also in addressing your question. It is actually important to note that there are effective strategies for managing suicidal ideation. I like to put it, that's the clinical term. And that's actually developing coping mechanisms that distract and soothe the individual, right? And there are some practical areas that I can mention at this moment, like creative activities, physical exercises, and mindfulness practices, right? Also, there is a particular therapeutic approach called cognitive behavioral therapy, which is CBT, and that actually can help in the identifying and reframing of negative thought patterns through a process called cognitive restructuring, right? And lastly, which is even more practical, having a strong support network, okay? A strong support network that comprises of relatives, friends, well wishers. This can play a very vital role. And so, that can help mitigate feelings of isolation and also help persons to feel that sense of belonging.
Wonderful. The next question I'll move on with is, encouraging individuals to seek help for mental health issues can be a very sensitive topic. What are some effective strategies or approaches that can help break down the barriers to seeking help?
Okay, so effective strategies and approaches in seeking help. So, breaking barriers. Now, first and foremost, suicidal ideation is very prevalent in the world today. There are persons who feel hopeless. There are persons who lose that sense of belonging. There are persons who don't have that identity of who they are, and so forth. And so, looking at breaking the barriers, first and foremost, I always say it is important to build meaningful connections, right? With individuals. That is my key point of breaking barriers, because one of the way of preventing suicide is actually connecting with others. Once we know what people are doing, when they are doing, how they are doing, that help breaks that particular barrier. And I will just leave. I don't know, I don't want to be too forward because I know there might be some relative questions coming soon, but for now, meaningful connections to break the barriers.
Understandable. Moving on to the next question. Given that every person's experience with mental health is unique, how do you go about customizing your treatment plans to fit each person's specific needs? What factors do you consider when creating a tailored approach, and how do you ensure the treatment plans remain effective and responsive to the changes in the individual situations over time?
All right, that's a great question. Now, first of all, I look at the practicality and the immediate things of everything. So, for example, the first approach and the most practical approach would ensure that the individual, that's the first thing, whether you are a clinician, whether you are a medical doctor, whether you are a suicidal gatekeeper, you want to make sure that that individual is in a safe environment that is free from any risk or potential risk. Okay. So that is the first thing. I always say that is like the psychological first aid response. You don't have to be trained to do that. You just got to know that, right? And so the first thing, of course, would be to do that and also go to the point of helping people speak empathetically. So at the end of it all, you want to make sure that persons are able to speak, you listen, you come to terms that this is something that is common, that is something that someone is going through, it's real, and help that person validate their feelings and remind them that help is available. Okay, so in terms of how I actually look at crisis planning and so treatment planning and so, it's important because now I it's a unique way I do it. I always ensure that persons are able to voice their emergency contacts because you see, suicidal ideation is so sensitive that sometimes there's not so much time to deal with that particular person, because it can be that person is going to act with that thought in the next second, in the next millisecond. So we want to make sure that we know who to contact, how to contact, and how to help them cope through that process. And it's so very diverse in the sense of how we see people, when we see them, how to engage with them, because different situations have different factors. But the main approach I see as the general approach is ensuring that the person is risk-free environment that does not exacerbate anything, and then of course ensure that you know the emergency contacts, know if they have anything that can help them, maybe the availability of resources, like for example a hospital setting where they can go to, an emergency casualty setting, accident and emergency where they can go, and all of that can help them. But in the practical sense of it, I always say that if the person is not as severe, we help them by sitting, validate their feelings, listen empathetically, don't judge, help them know that this is a safe and secure space. And that's how I do it, and that's how most people I know do it as they help persons navigate through suicidal ideation.
Splendid. My other question can be provided. What service does your clinic offer? Can you provide a detailed overview?
Oh, sure, no problem. So at Dr. MJR Psychological Clinic, we offer a comprehensive range of services. Actually, these services are actually aimed at addressing various mental health needs. Of course, we do deal with individuals who have suicidal ideation, but on the general set, these services include mental health consultation, psychological evaluations, psychometric assessment, psychoeducational intervention, referrals from psychiatrists, also therapy, which is a big thing and the most common, individual, couple, group family therapy, and also life coaching and mentoring services, and the list goes on and on and on.
My final question to you would be, can you share any stories or challenges that you have influenced your approach to mental health treatment?
Okay, so there is a caveat to that response. I'm going to give you the ethical response and I'm going to give you the allowed response. So I'm going to explain that in a few. So first of all, of course, client confidentiality is important and that is vital. So I've, just giving you the ethical response. And of course, I do have some stories I can share, or one I can share of persons I have gotten in, consent, of course, not sharing their name and sharing their demographics, but and share that with you in a bit. But while maintaining client confidentiality is vital, I've worked with individuals who have moved from experiencing severe depressive episodes to leading fulfilling lives through consistent therapy, support, guidance, and so. Of course, you can only imagine in Guyana there's a lot of social and societal stigma, a lot of limited resources, and so persons were not able to get the help before, but they were able to have the help through my clinic, and so they were able to more or less navigate through. I'm just giving that as a general ethical response. But now for another story, with a young woman who has already given me consent to share it in a psychoeducational way. It was a young adult, and that individual had depression, anxiety, and suicidal ideation. Now she felt hopeless. She felt as though nothing was happening for her. She lost interest in daily activities. She didn't know what to do. She felt as though the world was on her back, and she really was at her lowest. And through therapeutic engagement, she was able to go through CBT, which is cognitive behavioral therapy. She was able to have that restructuring of her cognition, reframing of her thoughts. So her negative thoughts were then reframed to positive thoughts. She had a better outlook on life, and she was able to know that she is special. She is someone who is important. And now, long story short, she is now living and leading a very, very healthy life and a very happy life as we speak. And she is also advocating to other young women to who have gone through similar and is going through similar, so that they can recover resiliently just as she did.
Wonderful. Thank you, Dr. Moses. I sincerely appreciate the time speaking with us today. Your insights have been incredibly meaningful, and I'm truly grateful for the impactful work you do. As we wrap up, can you share one final piece of advice or hopeful message for anyone who might be struggling with their mental health or seeking guidance? Your wisdom and encouragement could be just what someone needs to find their way forward.
Oh, sure, no problem at all. So, I want to end with saying that mental health matters. And as much as we always consider physical health being the only facet and dimension of health, mental health matters. So, when you wake up in the morning and you feel as though all hope is gone, that's your mental health being challenged. So, at the end of it all, we want to make sure that mental health matters. Now, linked to that, seeking help when we feel a sense of hopelessness, when we feel as though all hope is gone and we don't know what to do, seeking help is not a sense of weakness, it's a sense of strength. So if you just tap into the moment of seeking help, that means that you're going to the part of strength for you. And that is the first aspect towards healing, seeking strength and identifying you need help. So my word at this moment will be that, hey, it's okay to not be okay. There are times when you are in a particular moment and you don't know what to do. You feel as though all hope is gone. You feel as though nothing is happening for you. You feel as though the end of the world and you want to throw in the towel on life. Remember that where there is life, there is hope, and there are resources out there to assist you to navigate through the path of healing, to cultivate hope, and to embrace true happiness. And it is so lovely that you can go through this and become better one day. Be strong, be hopeful, know that everything is going to be better in time.
It's very powerful. Thank you so much, Dr. Moses, for your time. It has been very insightful hearing you talk and just the stuff that you had to say. I'm sure when we release this, a lot of people will feel a great sense of encouragement. And, if they need therapy, they will come to you. Again, thank you so much for your time. And maybe in the future, we will work again with each other. Have a wonderful day.
Oh, yes. Thank you, and you're most welcome to take care.